Hi guys, welcome back to my YouTube channel, The Precise Dentistry. Today we'll be dealing with the topic called osteology. So osteology is nothing but studying the features of the bone. So osteology will be your first chapter in BD Shaurashya. Why osteology is so much important is that the osteology forms the base of the anatomy, and only if you know osteology very thoroughly, you will be able to study about the muscle attachments, the nerves and vessel courses and all. And as far as dentistry is concerned, we'll be mostly dealing with that of the skull and vertebrae. So first, we'll go with that of the skull one. So as you all know, skull. Even though I explain it in 3D or you study with any app, skull will be best known only when you take the skull in your hand, view it, feel the sutures, and only then you will know what is skull. Before moving into that, the osteology, I would like to introduce you to certain terms. First term, the most commonly which will be dealing two terms is that suture, and then we'll be going with the foramen. So, what is suture and what is foramen? Very simple. So as you can see here, this is usually the 360 view of the skull, where I'll be using only this picture mostly to explain you, and I'll be using the rest of the pictures too, but this is the major picture that I'm going to use. See, sutures are nothing but, can you see all the vertical and irregular lines? So these are nothing but, these are the areas where the two bones fuse together. So this is what is called a suture. Suture is nothing but the area where two bones fuse together. And foramen are nothing but, these are the foramens. That is, you have small pinpoint kind of like holes you can keep. These foramen are nothing but, they will give way for the veins to come out, and veins and arteries and nerves to come out and to supply the muscles that has been attached to that of the skull. So this is the two different terms and the two main terms that you have to learn before you go into osteology, that is suture and foramen. So as you can see, I have a picture of 360-degree rotation of a skull. When you rotate the skull 360 degree, you will see all these different images. So why have I put this image? That is mainly because skull can be divided, like it is divided into say for like five different names. It has been given five different four different names based on the viewing or the position of the skull. So first, we will go with like how you view the skull has particular name. For example, when I view the skull like this, so that is, I'm seeing the skull in just front of me, and this now, when I view the skull like this, it is called as Norma frontalis. So I am viewing it from the front, so it is called as Norma frontalis. So when I see like this, like these two, it is turned, right? It is from side. We see it from the side. So it is called as Norma lateralis. So lateral means side, and this is Norma lateralis. And as you see this image, I see it from the top. So this is the top angle of the skull. When you look the skull from the top angle, this is what you will see, and this is called as Norma verticalis. So next, can you see the image here? So this is back side of the skull, means like you're viewing the skull from the back side. So when you view the skull from the back side, this is what you will be seeing. This is called as Norma occipitalis. And what you see here is the base of the skull, and this is called as Norma basalis. So to revise again, this one here is called as Norma frontalis. This is Norma lateralis, Norma occipitalis, Norma verticalis, Norma occipitalis, and Norma basalis. So this is how I'll be saying it once again so that you become familiar. This is Norma frontalis, this is Norma frontalis, this is Norma lateralis, this is Norma verticalis, this is Norma occipitalis, this is Norma basalis. So this is how it is all, we are going to deal all these terms. You have to get exposed to new terms when it comes to osteology. So now, the skull can be divided into two main parts. One is the clavarium or the brain box, that is this part, this whole part, I will say. Like we have to hold it. So this whole part where it holds the brain box is called as clavarium, and then the rest, all these rest are included in that, the facial bone. So this is how the skull is usually divided. So when you see that like that, you the skull is mostly it is usually composed of 28 bones, where the clavarium, this part here will consist of 14 bones, and here it consists of 14 bones. First, now let us go to clavarium. So clavarium is the major important thing. So first let me go to clavarium. Okay, when it comes to clavarium, as I said, there'll be 14 bones. So what are the 14 bones and how it is being described? If you see it clearly, 14 bones, you have 5 bones which is paired, and 4 bones which is unpaired. So 5 into 2 is 10, and 4. So you have totally 14 bones, and I'm just speaking about only this part. This is the part which is going to hold the brain. So what are the 5 pairs of brain? If you see, you have to listen this very carefully. First, you see here, this bone is called as frontal bone. So this is in front. So this is in frontal bone. This is just a single bone. It doesn't have any pair. Next, we will now forget the pair and all. You just forget. I'll just first try to name so that you will be able to remember it. So this bone, since it is located in the front, this is called as frontalis, or it is called as frontal bone. Next bone which we're going to see is, let us go to this bone, the bone which is present here. So this bone is called as parietal bone. So when you see this picture, can you see a suture here? It means that there are two bones that is being ossified together to form one parietal, that is to form the parietal suture. So see, this parietal bone is a paired bone. It have two different bones. Next, come to this point. So here you can see here, this is what the magnification, that is, this point has been this is the point, this has been magnified here. So this bone is called as occipital bone. So occipital bone is a single bone. Then can you see the bone which is present here? This is called as temporal bone. So you see one temporal bone on one side, you see another temporal, another temporal bone on one side. So first you will say facial bone, frontal bone, then you see the parietal bone, then you see the occipital bone, you see the temporal bone. So and then you have, so now let us go into paired and unpaired. So first I said first we'll go for the unpaired ones. So unpaired ones are two unpaired bones you have seen here. That is frontal bone and then occipital bone. You already know it is unpaired. The rest of the two bones are inside the skull. So I will now show you the picture of inside of the skull. So this is inside. When you cut open the upper part, you see this inside. So you see a bone here. This is ethmoidal. So this is again a part of the unpaired because it is single. So we have one ethmoid, one sphenoid. So the 4 unpaired bones of the clavarium are frontal, occipital, sphenoid and ethmoid. So this is the 4 unpaired bones. Now let me take you through the paired bones. Okay, see, the paired bones are, as you know, there are 2 paired bones which I explained: parietal bone, temporal bone. So 2 paired bones are already over, and rest 3 are very very easy. You just have to remember the ear ossicles: malleus, incus and stapes. All these 3. So there are 5 paired bones in the clavarium: parietal, temporal, then the malleus, incus and stapes. So this is about clavarium. When it comes to facial bone, it is very very easy. You don't have to think much. So there are only 2 unpaired bone, and you have totally 6 paired bones. So 2 unpaired, so this is 12 plus 2, which is 14 bones. So first we'll go for the 2 unpaired bone. There are only 2 unpaired bone. One you all know, that is mandible. So mandible, this is mandible, this is maxilla. This is maxilla, this is mandible. So these are the two bones. First, I'll be naming. These are the two unpaired bones that you will. I'm sorry, sorry. Mandible is the only unpaired bone, and the other unpaired bone is vomer. So this is vomer. So vomer is the other unpaired bone that you will see. Uh, okay, sorry. This is the vomer. So as you can see very nicely in this image where we have marked, this part will form vomer. That is, sorry guys. Okay, this part, I'll mark it more clearly. This part is what is called as vomer. So the vomer and the mandible will form the unpaired part, and the paired parts are, there are many paired bones. So maxilla itself is a paired bone because you have a suture here, and you will be able to that is actually fused at the center. So this is, you have the maxilla and you have the zygomatic process. See this part, very famous bone, this is zygomatic, this is zygomatic, this will form the maxilla. Then you have the nasal bone, that is two paired bone. You have the lacrimal bone, I have already said this part is the lacrimal bone. You have two different lacrimal bone. Palatine bone, so see here, this is the palatine bone, and palatine bone has a suture in the middle. So palatine bone. Then we have the inferior nasal concha. So one sec. Okay. What are the different paired and unpaired bones of the facial? That's facial part of the skull. If you take, we have two unpaired. One is vomer, one is mandible. We have the paired. We have totally six paired. We have first we saw the maxilla. Then we saw the zygomatic bone. Then we saw the nasal bone. Then we saw the lacrimal bone. Then we saw the palatine bone. Then we saw the inferior nasal concha. So this is the first basic thing that you have to know before you start. What are the paired and what are the unpaired bones? So this have covered literally all the parts of your skull. Okay. So the next thing that we will be dealing with is that the joints. See, there are like the sutures. You know, you can see the sutures here, right? So there are different kind of sutures. All these sutures have different names that I'll be dealing it with later. Skull joint. There are three synovial joints. That is the joint that is in each side of the ear with that of the ear ossicle, and we have the TM, the temporal joint, which is one of the only movable joint in that of the cranium, is the temporal mandibular joint. And anatomical position of skull, when you position the skull should follow all these anatomical landmarks. That is one sec. Okay, you can see there are two planes that we use. One is Reed's base plane, that is connecting the this is the infraorbital margin to that of the middle part of the external questing meatus, and we have the Frankfurt horizontal plane, which connect from the infraorbital margin to the upper part of the horizontal plane. This is how you have to remember the positioning of the skull. And the base of the skull, so this is the base of the skull. The base of the skull is usually ossified it is mostly intracartilaginous in nature, whereas the cap of the skull, that is the upper part of the skull, is intramembranous in nature. You have to remember these two. And all these foramen we'll be dealing it with later. And some bone, for example, like frontal bone or maxilla, they usually have air cells. The frontal and the maxilla have air cells. That is mainly because there are four different functions, that is to reduce the weight of the skull. So when they have, this is the frontal and this is the maxilla, when they have air cells, they will reduce the weight of the skull because it carries heavy organisms. Then maintain humidity, give resonance to the voice, and they may get they may get infected, resulting in sinusitis. So there are plus and minus in this air cell. So now we'll be dealing each norma in details. And first norma that I'm going to deal here is norma verticalis. So norma verticalis, first we'll be seeing the suture, and some of the features of Norma verticalis and one of the important clinical anatomy. So first we'll be dealing with sutures. So as you can see around a suture called as, this is the coronal suture. The coronal suture is nothing but the suture that is connecting the frontal bone to that of the parietal bone. The next suture that you see is sagittal suture. Sagittal suture will connect the two parietal bone. This suture is connecting two different parietal bone. Then you have the then you have the bregma and the lamboid suture. Lamboid suture will be best seen here. First I will say what is bregma. Bregma is nothing but this is the point, that is where the coronal and the sagittal suture meet. There are the two pair of the parietal will be connected to that of the frontal bone. So what is the importance of bregma is that the main important thing is bregma will usually fuse only in the 18 months year old 18 months. Once the baby is 18 months only it will get fused. So when you see a baby, when you touch it in the middle of the bregma, you will see the area is very soft because that hasn't fused yet. Like till 18 months it will not fuse. This is mainly to allow the maximum growth of the brain. So bregma. Then you have lamboid suture. So lamboid suture is nothing but this is kind of lambda. So that's what it's called as lamboid suture. So this it is going to connect the occipital bone. So this is the occipital bone. This will connect the occipital bone, parietal bone, and the temporal bone together. Then you can see one more will be there, that is metopic sutures are those sutures that has been present in frontal. It is only seen in about 3 to 8% of the people, even in the heart of the adulthood. That is mainly because it usually fuses in 2 to 3 months of the age. That is the maximum age in which it will be present, so it will fuse after that. The next thing is what you have to see is the bregma, the lambda that I've already mentioned, and then you have to know about the parietal foramen. So as you can see, two different foramen that has been present here. This is called as parietal foramen. So why what is parietal foramen is that this will transmit the emissary vein. Emissary veins are nothing but the veins that connects the extracranial veins to that of the intracranial veins. That is called as emissary veins. EMMSA. I'm sorry about my very bad handwriting. I usually have good, but it is okay. Emissary vein. So that is all you have to know basically in Norma verticalis. And clinical anatomy is that there is a captus succedaneum. So I will mention here captus succedaneum. What is captus succedaneum is that soft tissue swelling will be seen in any part of the skull when there is the rupture of the capillaries. That is mainly, this happens mainly due to that of the delivery time. So during the when the baby comes out, there will be rupture of capillaries and you can see a soft tissue swelling there. So that is called as captus succedaneum. So this is all about Norma verticalis. So the next thing I'll be covering today is Norma occipitalis. So what is Norma occipitalis is nothing but this is Norma occipitalis. When you see the behind part, that is Norma occipitalis. So in this, what are the bones that we see here is that you can see these are the two parietal bone. You can see the occipital bone. Then you can see the temporal bone here. You can see the mastoid process here. And what are the different suture we are seeing? We are seeing sagittal suture here. We see the lambda or lamboid suture here. Then we see the parieto-mastoid suture. Nothing but this is the parietal bone. This is the mastoid process. This is connecting the parietal, mastoid as well as that of the occipital bone. This is parieto-mastoid suture. Then you can see occipito-mastoid suture. So occipital, this is mastoid. These are connecting together. This is called as occipito mastoid suture. Also you can see, this is parieto mastoid suture, this is occipito mastoid suture. Then asterion is nothing but the point which connects the this is the temporal bone, that is the mastoid part is also there, temporal, occipital and the parietal. So that part is what is called as asterion. Asterion is it is connecting, stereon will connect the parietal bone. You can see the parietal bone here, you can see the occipital bone, you can see the temporal bone, and mastoid process is a part of the temporal bone here. Then okay, you see the temporal bone also here. So these are the sutures that will be seen. So what are the other structures that you see here is that, see, you see two different lines here. This is superior nuchal line, this is the inferior nuchal line, this is an external occipital protuberance. So you can, when you take a skull in real, you can feel all these protuberance, but now it is not possible. And then external occipital protuberance, you know, before up 1 centimeter up of external occipital protuberance is the highest in nuchal line, but that will not be present in most of the individuals. It will only be till external occipital protuberance. And now we will have to see the attachments. So the upper part of the external occipital protuberance here, there will be a muscle attached that is called as trapezius, and the lower part of the thing will give attachment to that of the ligamentum nuchae. So upper part, it gives the attachment to that of the trapezius. The lower part is giving attachment to that of the ligamentum nuchae. The next is that the superior nuchal line. The median part of the superior nuchal line again gives rise to trapezius, whereas the lateral will provide to sternocleidomastoid, which is one of the most important and famous muscle, and splenius capitis. You have to remember, median is trapezius, sternocleidomastoid is the lateral, and splenius capitis is also lateral. The highest nuchal line will attach the median part of epicranial upper neurosis. That is again, it is a part of the skull that we'll be dealing with the later. And also the occipitobelly of occipitofrontalis muscles. Belly also will get attached in the higher nuchal line. But sometimes in most of the individuals, as we know, I have already said, it will not be present. So that time all these structures, that is the occipital belly as well as that of the epicranial upper neurosis, the middle part, will be attached to that, the superior nuchal line. So guys, today we have seen the basics, the important structures, and what are the paired and the unpaired skulls. We have seen Norma occipitalis, Norma verticalis. So in the next video we'll be dealing about frontalis, lateralis, and basalis. So thank you for watching. If you have not liked, please do like the video, share the video, and subscribe to my channel so that you get notification once and one while I upload the new videos. Thank you guys.